Often seen donning a headband with big flowers, the love for Blakelyn blossomed well before she left the womb.
Hi, bud.
Seen here in hospital at 4.5 months old, the budding fashionista stays true to her style as her doting parents sow seeds of hope around her health. Blakelyn's medical journey has been a bumpy ride.
There have been a lot of moments where it's been a very close call.
Born with heart issues, she then developed severe breathing issues that would force several surgeries on a tiny newborn body.
It's just, like Cody said, very hard as a parent not to be able to help or to do anything. But again, it just takes time, and unfortunately we know that when she has one of her episodes, one of her spells, it's generally her airway is collapsing, and we just need to give it time for her to relax and to let the airflow come back through.
Yet, in the middle of an isolating pandemic, it can feel like time isn't on your side. Family and friends had no choice but to love from afar. COVID-19 is a respiratory virus posing a huge risk to a baby already living with a collapsing airway. And that issue isn't even the main one.
At their very first appointment, we diagnosed Blakelyn as having complex congenital heart disease, which encompassed overall something called a complete atrioventricular septal defect.
Simply put, Blakelyn was born with a partially developed heart. The 4 chambers and none of the walls had formed properly. Without those natural barriers, her oxygenated and non-oxygenated blood were mixing. On top of all that, she has a narrow aortic arch, which makes it difficult for blood to flow through and reach the rest of her body.
Knowing she's in the best hands allows us to sleep at night, whether it's here or at home, and keeping in mind that she is going to be taken care of.
Without question, Courtney and Cody say their saving grace has been CHEO. The baby who dresses like a pop star has a room to herself and an adoring team of professionals looking after her.
We consider all of the nurses her aunts and uncles, and they've really become her family.
A priceless amount of care that truly depends on donor dollars. Small bodies can require tiny equipment and also come with huge challenges.
There's always a chance that there can be a child who passes away in utero.
Technology allows for diagnosis before birth. At 18 to 20 weeks, with a heart the size of a quarter, doctors could already tell something was wrong. It means they could plan and not be caught off guard when Blakelyn was ready to take center stage in her family's life.
I always tell families, like, my job is to prepare for the worst and your job is to hope for the best. Like, that's how it works.
Yay! After months at living at CHEO, Blakelyn is now home full-time.
Where are my kisses?
Still more surgeries to come, and appointments are far from over. But for the O'Reillys, coming to CHEO is like coming home, period.
On our best days, they are our best friends, and on our lowest of days, they've been our support and our family.
A place of comfort, not only for young patients, but parents too.